Welcome back to the 49th Annual AAKP National Patient Meeting. I hope we all had a great break and are feeling energized for the remaining sessions ahead. I know I am. My name is Hickey, and I'm president of the American Association of Kidney Patients, and as a fellow kidney patient with experience as both a caregiver and an advocate, as well as for my family members who have also been impacted by kidney disease. These experiences have provided me with a profound understanding of the difficulties that my fellow patients and their loved ones encounter as they work to manage and navigate this condition. At AAKP, we work to ensure that patients have a central role in the research and development process, as well as in the development of policies that have a direct impact on their care. This is why AAKP stood up its Center for Patient Research and Education and its Center for Patient Engagement and Advocacy over a decade ago to act as a rapid fulfillment hub for government, academic, medical device manufacturers, and pharmaceutical industry requests to engage kidney patient experts as a mechanism to speed the utilization of unique patient insight across both the product development lifecycle and within regulatory and payment decisions. The field of kidney disease innovation has experienced remarkable progress in recent years, bringing to use new drugs, diagnostics, and devices. And as companies continue to expand the horizons of medical sciences, the future of kidney disease treatment looks promising, and the potential to improve outcomes for individuals with kidney disease is vast. However, all of this advancement means nothing if patients do not have care, choice, and access. This is becoming a perplexing scenario the kidney community has found itself in, and which is the topic of today's session titled, Under the Dome, Government Determinants of Health, the New Barrier on the Block. AAKP defines government determinants of health when federal health care agencies lose sight of their primary duty to safeguard the vulnerable populations they serve. Furthermore, government determinants of health means government has migrated from the role of problem solver to becoming an institutional barrier to improve clinical outcomes and an exacerbator of health disparity. During this session, we will dive into a critical conversation on how government policies shape health outcomes and access to care, and how we, as patient and healthcare professional advocates, can work together to overcome these artificial barriers. We are fortunate to have representatives from two allied partners joining us virtually today. They bring a wealth of knowledge and experience in healthcare policy and patient advocacy. These leaders and the organizations and companies they represent have a long-standing relationship with AAKP and have worked closely with us to improve patient care and advance key policy initiatives that benefit the kidney patient community. First, I'd like to welcome Dr. Alan Ryan, Senior Director of Patient Advocacy at Ardelyx. Dr. Ryan is an accomplished executive pharmacist with a passion for creating value for positively impacting patient outcomes. He has over 25 years of impact generation in the pharmaceutical biotech industry, including over 10 years of patient advocacy. Dr. Ryan, I turn it over to you.
Thank you, Ed, for that generous introduction. I'm excited to be able to participate in this panel, and I will just say I'm so sorry that I cannot be there in person. I had very much planned and looked forward to coming. But as it's obvious, the weather just wasn't cooperating. So I'm sorry I cannot be there. Really do passionately believe in what AAKP is doing. One other thing I always like to share when I'm engaging with our patient advocacy partners is I myself was a caregiver in high school. I lived with my grandmother who was on kidney dialysis. And so I was her driver, 3 times a week, taking her back and forth to get her dialysis treatments. And candidly, I only wish that she had known about organizations like AAKP that are so critical in making sure that the patient's voice is heard as it pertains to having access to medicines and having the best possible outcomes for healthcare. And so I'm glad to be here today. I know that we're going to be discussing government determinants of health. I'm really interested to explore how we can work together more on advancing patient access, particularly when it comes to products and services for patients who are on kidney dialysis. And I just know that we have a lot of opportunity to continue, frankly, the access that these kidney dialysis patients have enjoyed for some time now, since 2011 at least, through maintaining access for oral therapies in Medicare Part D. And so I know that that is something that AAKP is championing as well through the form of supporting the Kidney Patient Act, which is meant to essentially extend the access to therapies, oral-only therapies in Medicare Part D. Ultimately, that's what it's for, and not have those oral therapies folded into what's commonly known as the Medicare bundle, or the bundle payment for dialysis services. I know it's commonplace and understood that the oral-only therapies are not by themselves dialysis treatments, and so they really are best served by continuing to be available through the Medicare Part D option. And so we are delighted to continue to champion that in partnership with AAKP to advance patient outcomes on the Hill and keep that before the legislators so that they will, in response, take good care of their constituents. And so that's why we're, let's just say, continuing to be leaning forward as much as we are, and we look forward to continuing to make sure that this does happen by the end of this year. So I know that I believe we have some time for Q&A discussion. I'm wondering what questions there are, and because this one-way communication is a little different, so I can't really read faces here. So Ed, I'm going to turn it back over to you, and then ask what things you'd like me to cover. Thank you.
Appreciate that. We'll pick up the questions after Peggy goes. So if you could just hang tight for a little bit.
Sure.
I'd like to next welcome my good friend, someone who's a staple at all AAKP events. She does outstanding policy work, and right now, I'm sure I'm going to embarrass her by letting everyone in the audience know that she was just awarded a Lifetime Achievement Award by the Women in Government in Washington, D.C. for all of her work. And, you know, I got a Lifetime Achievement Award last year for something, and I just wonder, what is that? Does that mean we're getting old, Peggy, or does it mean, yeah, I can
Apparently.
she's the principal at Pyles, Sutter, Verville, legal counsel for the American Society of Transplant Surgeons, a close allied organization or partner for AAKP, and Peggy specializes in advocacy, coalition building, grassroots campaigns, and media relations, and is known for her expertise in areas such as Medicare reimbursement, patient safety, and mental health policy. Peggy's been instrumental in guiding policy changes and legal strategies that support transplant patients and medical innovation, and is just a champion for all kidney patients up on the Hill. So, Peggy, I turn it over to you.
Thank you, Ed. Always great to see you, and so excited to be working with AAKP. I heart you guys big time. So, Paul, Aaron, Jerome, Richard, Ed, you're the best. You are the best on the block. You do fabulous things, and thank you for having me again at your meeting. Kidney patients and transplantation. Boy, have we had it between the eyes in the last couple of years from a policy perspective, or as Paul likes to call it, under the dome. I'm also really thrilled to see this branding of government determinants of health. It is a stroke of genius, really, on the part of AAKP leadership to talk about, well, to coin a term, and then also to talk about this term of government determinants of health. How is the government influencing transplant policy? That's a really important thing to talk about, and that's what I'm hoping to talk about today. So it's wise, beyond measure, to have this conversation. So here is my quick bio. Okay, maybe not so quick, but yeah, that's Wittenberg University in Springfield, Ohio. Hold all your dog and cat jokes. We'll talk about that later. What I'm going to talk about today is rebuilding trust in the system. I'm a lawyer, I'm a lobbyist, and as I like to say, my family still talks to me. It is a really, really tough time doing what I do for a living, advocating for kidney patients and transplant surgeons through ASTS in the last couple of years, because there is so little trust in our government writ large, right? And that has a lot of factors. There's a lot of reason for that. But all of that has translated down to, unfortunately, lack of trust in the transplant system. So let's unpack that a little bit. What is national trust? I believe, and if you've been watching the news for the past couple of years, you will see there are tons of news stories talking about the problem of transplantation, the problem of the system. Let me just start by saying, we know, everyone wants more transplantation. We want people to live longer. We want people to live better. But is this really the way to instill public confidence and trust in a system when all you're seeing on the news is the wasted organs and throwing things away and this disaster and that disaster? Honestly, a lot of this is manufactured, and it's frustrating to see it when I'd like to see, and this is what I try to do, and I know Paul and Ed and Richard do this on a daily basis, is to, as Ronald Reagan liked to say, trust but verify. We're hearing things, we go find out what the problem is, you address it from a policy perspective, and make things better. It's really easy to just slap a bunch of news stories out there and talk about the horror and the awfulness, and then slap together some policy to try to fix it. That's not how our government works best, I think, because what we do in the meantime, especially in the world of transplant, is erode the public confidence. We're talking about a surgery with living donation where somebody is altruistically saying, take a body part of mine. I trust you, transplant team. I trust you, federal government, to do everything right, that there won't be harm to me or my family, and that I really am doing a good thing for another person. So with these kind of news stories and this kind of attitude about transplantation, I'm worried that there are people who could be donating who are going to go, whoa, this looks like a mess. Why would I want to do that? This is why I think it is so incredibly important that we all must act with integrity, transparency, fairness, and competence in serving the public interest. And I say we, I mean our federal government, but I also mean transplant surgeons, the transplantation teams, the OPOs, those organ procurement organizations, and everybody else who's part of this transplant system has to be at the highest level of integrity, because we all want the same thing. We're not fighting each other because we all want the same thing. So frankly, we shouldn't be fighting each other. What are the facts? The facts about the transplantation system is that the US transplantation system is the very best in the world. I dare anybody to criticize me about that. Compared to other countries, we are better. Without question, we are better. We are better because we do it well, we do it ethically, and it's increasing. The number of organ donors have increased dramatically in the past couple of years. All of that is a really good thing. But I didn't stop there. We can and we must do even better. So there are policy ideas that are coming out, frankly, every day. Not all of them are good. Not all of them meet those tests that I was talking about of doing things that are ethically correct, that are proper, that are protective of the right of the populations who would either donate or receive kidneys or other organs. So from the premise of national trust, is we got to start from national trust. We've got a great system. Can it be better? Yes. How do we work together to make it better? This is what I do in talking to policymakers on a daily basis about transplantation. Stop with the yellow journalism, stop with the media attacks, stop with all of that, and let's get down to brass tacks. This is a very complicated system, and it needs to be attacked intellectually, academically, with that same passion with which we're all approaching this debate, because it's personal to me too. It's personal to all of you, I know. Whether it's you or a family member or people in your community, this is personal, but do not let the personal cloud your vision and your judgment about what policy making is. Policy making should be smart. We should be working with each other, allies and advocates, in swimming up the same stream. And there are ways we are doing that. And so it's just to wrap up this idea of national trust. Here are the big policy questions that I wrestle with on a daily basis, because I look at bills at the federal, mainly at the federal, also at the state level, hearing policy ideas about really well-meaning people who just want to change the system. They saw their mother die like I did. She didn't get a kidney. I want change fast as well, but we really got to take a step back and do this right. Who should be making decisions about who should receive a transplant? Who gets to make that decision? Certainly not me. Who should be determining which organs go to which centers and to which recipients? Should the government be making clinical decisions? What is the proper role for surgeons, providers, and patients? What is the proper role, more broadly, for government in transplant altogether? Should we pay people to donate their organs? How much? How much money is too much money? Do we marginalize the poor? Do we give people the wrong reasons to make them coerce a donation? I've seen some policy proposals that have big numbers in tax incentives that I frankly would have given you both of my kidneys. And maybe today I'd give you both of my kidneys. Some of those numbers are really high. I told the transplant surgeons that a couple weeks ago, and they didn't laugh. They explained to me that I couldn't live with both kidneys. You gotta love the doctors, right? So sometimes my jokes don't hit. Anyway, what about refundable tax breaks? Are those the answer? At what number? Is it 50,000? Is it 5,000? What is the right number for a policymaker to decide we're doing the right thing? Are there many answers to solving these problems? Or is it a one-off? We should do this one thing here and this one thing here and this one thing. Or is it comprehensive reform? What should the government do first and how? But also, what are they already doing? What is already underway? These are the kind of considerations when a bill comes to my desk or to my computer that I have to think all the way through before I make a recommendation to the American Society of Transplant Surgeons to say, this idea is half-baked, this idea isn't the right way to go yet, this idea should have the support of more people, and I'll give you an example of that in a minute. Also importantly, and I don't want to forget this because I know you had a lot of wonderful speakers that I dialed in for who talked about the role of technology. How do we foster those advances? If we do nothing in advancing technology, do nothing on improving the medical science, we've lost the war. We've blown it. We have not done what we need to do to make sure that we have the best medical science and the best inventions that will make this problem something that I hope your grandchildren are going to say, you did what? You sat in a chair and got dialyzed? You got to be kidding me. That's the future I hope we have, but we have to be able to be supporting technology in getting to that very important place, right? How we create transplantable organs, living donation. Maybe in a couple generations, people will laugh at the idea of living donation because we'll have something else, because something else will help us get to a place where we don't have kidney disease. So technology, super important. Don't want to forget this in that equation. What I did here is talk about where we started. So as a lawyer, where we start is with the law. And Ronald Reagan wrote into law this thing, or signed into law, NOTA. And NOTA is the National Organ Transplant Act. So every time I'm looking at a proposal, I go back and look at NOTA and see what NOTA said. What NOTA was meant to do is promote the donation of organs. At the time, it was liver transplants for children that the GIPR cared most deeply about. What they put together was a public-private partnership to do that. It was not all government making transplant decisions. I personally believe that would be the worst situation in the world, is to have a politicized system where the federal government could be lobbied by people and who gets a kidney. Is it the rich this year? Next year it's the poor? What about the Haitians? Let's go get their kidneys. I know I might sound a little ridiculous, but that's what I'm trying to guard against, is political decision-making coming between you and your physician, your surgeon, and your transplant team. So I take a lot of where we came from legally with transplantation, and that starts with NOTA. This is a balance that, frankly, I stole from somebody else, so I will give credit where credit is due. A friend of mine at UC San Diego put together this nice little visual, and I doctored the words on the right, so now it's mine. I believe in what she was saying, which is, yeah, the system needs to change. The public demands it. We demand it. We need change. Change could save thousands of additional lives. Quality and process improvement are the foundation, and we're doing a lot of that, but we can't forget to rebuild the public trust, because without the public trust, in particular on living donation, but also for deceased donation, it's absolutely necessary for success. To ask somebody to give a loved one's body part after their death, or a person to ask for a body part during their life, takes a lot of public trust. So I told the physicians a couple weeks ago, keep the faith, keep talking about transplant as the right thing, a good thing, and yes, it's getting better. If we fall into the trap of it's all negative and it's a mess and it's such a problem, nobody's going to be there to make the system work the way we need it to work. Also, I think it's incredibly important to not throw the baby out with the bathwater. We have 50 some years of experience in doing transplantation, and we just keep getting better. And this isn't just the medical side, this is in policymaking. We have gotten better at how we're doing transplantation, but we should not throw the baby out with the bathwater. We should make the right change that's going to positively impact the most people and not have any unintended consequences on anybody we certainly didn't mean to harm. I'll give you a snippet of where I'm going. The Living Donor Protection Act, in my opinion, is the first thing Congress needs to do. You know what the Living Donor Protection Act is, I believe, is to remove financial disincentives to transplant. Removing financial disincentives to transplant before we ever get to the point of paying people for their organs is what we know will be the most effective in building that public trust in the system, in not just the institutions, but in your ability to say, I'm going to be protected in my job. I'm going to be protected in insurance for myself and my family going forward. We have a real shot of moving the Living Donor Protection Act, and that kind of bill is where we should start. This Congress is a giant mess. I could talk for days about how bad it is. But I'll tell you, that bill, for the first time ever, has a chance, and a real chance. We have 5 national insurance associations supporting the bill. So we have no opposition. There is no cost to the bill. It does the right thing. It's fully supported by everybody in the entire transplantation stakeholder universe. Why can't Congress pass it? So we need you. And I know that there are beautiful advocates, people who went through a hurricane to be sitting in that room today. God bless you. Please keep fighting for the Living Donor Protection Act, because that's, I think, the first right step. And there's so much more that's happening. Get yourself involved in those processes to make sure that the government determinants of health, as AAKP has so rightly termed it, do not have unintended consequences on you or your family, to make sure that your team, your surgical team, and your community comes first before any kind of government policy or campaign messaging. And that's the kind of work that AAKP does for you, and which is why I'm so proud to call them, honestly, one of my very best partners in this town.
Very much for that, and we'll get there with the Living Donor Protection Act. I mean, we've at least narrowed it down to one committee and a small group within one committee, and I think that with our collective efforts, we'll be able to move it across the finish line. I'm confident of that. And yeah, it takes years, right? How long did it take for transplant drugs? 15 years, I think? Yeah.
Yeah, right.
So we'll get there. We're on our way to victory. I can feel it. And thank you both for your presentations. And I just have a couple of questions I'll open it up with, and then we'll turn it over to the floor. So to both of you, to either of you, we have government policies that often have unintended consequences, and you hit on this a little bit, Peggy. with access and outcomes. And in your experience, what are some of the most significant government determinants of health that kidney patients face today?
So Dr. Rush, go ahead. You wanted to jump in?
Well, so yeah, I'll share a few thoughts. To start off with, the bundle that was created to pay for dialysis services was originally a good idea, right? To essentially make sure that every dialysis patient had what he or she needed. But somehow that has morphed into a catch-all, one-size-fits-all that the government is wanting to keep enfolding other things into that from the very beginning were not necessarily considered the best for the patient. And so this is one of these areas where, for instance, with oral only therapies, the idea that CMS is going to insist on folding in oral only therapies into the dialysis bundle payment, when it's clear that Congress has said 3 times that that's not a good idea, is something that CMS is creating a government determinant of health, because essentially if these products are folded into the bundle, it's going to complicate patients getting what they need, patients getting what they need from a patient and this physician decision-making standpoint, that being interfered with to some degree. And so this is just one of these realities that the government is essentially inserting itself in a way that the entire kidney community has said is not healthy and not good for the patients. At this point, the Kidney Patient Act itself has a CBO score of 0, so it doesn't cost the government any money to leave the things the way that they currently are, where oral-only therapies are paid for by Medicare Part D. And so it's just really an odd situation where you have a bill, something that's going to happen to change how products are paid for, in spite of what the patient community has said and in spite of what the physician community has also said is best for patients. And it's not going to save the government any money whatsoever. So it really is a situation where you can have good intentions at the beginning, but then over time, there can be some, shall we say, unhealthy evolution in how a government policy is implemented, and that can have negative impact on a patient.
Thanks, Helen. Peggy?
I would just add, if I may, that the big issue right now for a lot of our stakeholder groups is the OPTN modernization. So about a year and a half ago, Congress passed in a bipartisan, bicameral fashion, that means the House and the Senate, Republicans and Democrats, passed legislation that became a law saying, hey, let's reform how we do transplantation in the United States. So organ procurement transplantation network is being remodeled and rethought through. So our association, ASTS and AST and AAKP, are supportive of OPTN modernization and supportive that there will now be new contractors who are working to better the system. That is all really good news. It's the details that are gonna really matter going forward. And some of the high points I would say, and we have been saying to the administration and to Congress, is make sure you protect that public-private partnership. And those are fancy words to mean we should have input, right? Patients should be front and center. Surgeons who have done this for many years of their careers, they're taking care of these people every day, they bleed for their patients, should be involved in the decision making. There are about 1,000 volunteers who help decide where organs go across this country. 1,000 people. Let's not throw them out. Those are the OPTN volunteers. So we're saying a lot of things to help the government do this the right way and help these new contractors manage the system to not throw the baby out with the bathwater, to make the system better because they're listening to people, because they're talking to experts. And that the patient voice doesn't get lost in all of that is one of our highest priorities.
All right. Well, thank you for that. And Alan, getting back to the bundle, we we ask that question a lot up there on the Hill and in front of government agencies, and the question, the response that we get is generally, well, what's the alternative? And I think that the challenge is coming up with something that the fee-for-service system wasn't working, the bundle isn't particularly working very well, so what is the solution? And there's not a clear answer, and it takes effort and again, really rigorous thought to come up with something that's going to work on such a broad scale too, because you have unintended consequences once you implement a new payment system as well. My next question would be, what role do you think government agencies should play in addressing social determinants of health, such as access to healthy food or transportation, that disproportionately affect kidney patients? Peggy, I'll give you the first shot at this one.
Yeah, I think it's integral to this conversation. We know that healthcare is never just about getting a drug or getting a treatment. It is so much more than that, especially with kidney disease, end stage or otherwise, is the comprehensive care that you're receiving. What can the government do to help things like not just nutrition, but housing? People have to be able to get the care that they need, but there's a cost to all of that. So that's the balancing act everybody who works in this space has to do, is figure out the balance between the cost to the system, but also to patients and their lives and the quality of their lives. Can we afford this as a country? Can we afford not to do this as a country? The advance of new weight loss drugs and things like that. Where are we putting our investments as a country to make us safer and healthier going forward? And our argument, I think, is the kidney community is, let's wisely choose where we can go to make the most impact. Sometimes no nutrition, no diet drug is going to do anything for your kidney disease, because it's a different type of kidney disease. We're aware of that, right? There is a lot the government can do, but we have to do it wisely, I think, is probably the simplest way to answer that.
Thank you. Alan, do you have anything to add?
Yeah, I'll just add that I think what's key is that they do it in partnership with the community itself, right? Sometimes they either ignore an issue altogether, or they ignore it altogether, or they're not listening. So if they would lean forward and listen to the patient stakeholders, the healthcare providers who are trying to take care of various patient groups, those individuals, the patients and the healthcare providers, are aware of the needs of the social determinants of health that are unique to each particular patient group. And then they can curate and help to make clear, here are the priority ones for our particular patient community, and then here are some potential solutions for that. So I think really, in some measure, it just boils down to some intensive listening.
Great. Thank you. And now, final question for me, and then I'll turn it over to the group. With the legislative and priority shifts that are going on, what are some anticipated changes that could further impact health outcomes for kidney patients, and how should we prepare for these developments? So putting your crystal ball to work here.
Yeah, so I'll start by saying OPTN modernization has really just started in earnest, and that's going to take an entire community watching and helping and advising along the way. There's also a potential or proposed demonstration through the Centers for Medicare and Medicaid Innovation. So the innovation centers are working on trying to encourage more donation. That's something else we've got to be intimately involved with as it's going forward. Living Donor Protection Act, you know how much I love that bill, and it's got to pass. Congress is now gone until after the election. So what's going to happen in the election? Boy, I wish I had a crystal ball for that. I don't know. They have about 20 legislative days between the House and the Senate and the end of the year. So in 20 days, that's how much time we have left to convince Congress to move LDPA. That's not a lot of time. So everybody should be really pushing their agendas and very hopeful that the election results aren't put people in a place to say, well, we're not going to be in power next year, so I don't want to move anything. Mm-hmm. We have to demand as the public that things that are bipartisan and bicameral that don't cost anything have to move this year. We're not waiting until next year. They need to move this year.
I hear you. Alan?
I will say similarly on the short term, We have the Kidney Patient Act is bicameral, bipartisan, and doesn't cost anything. And we're very hopeful that, this year that their action can be taken. We are aware of the realities that the Kidney Patient Act does not pass this year. Then January 1, 2025, there will be changes made that are not friendly to patient and physician choice. And that's reality. So we know we've got a hard timeline to work against. But I will say at the same time, I think, Ed, and to try to answer your question, you mentioned it earlier, and I think there is a general sentiment on both sides that the payment system overall is not necessarily working well for optimizing patient outcomes. And so there is some talk about, well, how do we do it well? What does an overhaul look like? But we all know that that's a very long-term proposition that will take a lot of discipline, thought, and engagement. But it's at least being talked about at this point.
All right, thank you. Are there any questions from folks in the audience? All right. Well, one final one to take us on home, and from your perspective, what are the biggest opportunities for improving the partnership between healthcare industry, patient advocates, and the government in addressing the government determinants of health? Where can we really have the most impact?
Yeah, I think that a big part of my speech is rebuilding that trust, to know that the OPTN, for example, is not the same as the contractor. The OPTN is those 1,000 volunteers and board members who, with their heart and soul and passion, want to make the system better. We shouldn't be tarred, if you will, by the same brush as a former contractor. I know that's way in the weeds, guys, but it's a reality of having folks look at us in a way that we're not trusted just doesn't seem fair or right by any stretch of the imagination. So we're trying as hard as we can to convince them that our hearts are in the right place, our kidneys are in the right place, and we're doing this for all the right reasons, because we do care deeply about patients.
Thank you. Alan?
And I'll just say, from our perspective, the one word would be listen, right? There seems to be a lot of deafness, basically, when you have kidney groups like AAKP and literally all of the major patient groups in the kidney community, and many patient groups in the health equity community, and the physician groups in the kidney community, and then the list just goes on and on. There are dozens of groups have all said that with one voice, a message to CMS and to the Hill, one thing with no opposition. It's just it's striking that there doesn't seem to be, at least from a CMS perspective, a lot of listening that's happening. So that would be the one request, would be some actual listening. And if not, there can't be a guarantee of agreement, but at least some dialogue to say, well, here's our why. And so that would be my thought.
Great. Well, thank you. And to both of you, thank you very much. I want to extend our appreciation for the two of you joining us today and for fighting the good fight to make sure the federal agencies honor their commitment to those who serve by supporting research and innovation to disrupt status quo kidney care. And furthermore, that the government does not stand in the way of patients having choice and access to the latest diagnostics, treatments, and devices.